Hello, this is Dr. Gueye with the Visionary Women's Health Clinic, and I'm here to answer another requested question. Today's topic is infertility, and the specific topic today is how much can your gynecologist actually do? And do you need to go and pay the big bucks to the REI doctor, the reproductive endocrinologist, to do procedures that are often not covered by insurance, and when do you need to do that? Now, there are lots of women who definitely need to see an REI sooner rather than later, and it's important to have that frank discussion with your gynecologist, and they will be able to guide you. But I want to spend some time today to let you know exactly what your gynecologist can do. Now, first and foremost, your gynecologist can absolutely work up your infertility and try to pinpoint exactly where the issue may be. This is important because some issues don't necessarily require an REI to address, such as organic issues, perhaps a thyroid imbalance, or maybe an anatomical reason such as fibroids, polyps. All of those things can be addressed with your gynecologist directly. Preconception counseling is also important, and your gynecologist should be able to review your medical history, your medications, give you some advice on what can optimize not only your pre-pregnancy but also your pregnancy health. And they can also help with timing and exactly how do you try to conceive. It may seem like common knowledge. Don't get on birth control, have sex, you should get pregnant. But it is a little bit more involved than that, and your gynecologist should absolutely be able to talk to you about how exactly to time intercourse and what exactly to do so that you can get pregnant. Now, in terms of specific reproductive assistance that your gynecologist can do, it's really going to depend on your specific doctor. Some gynecologists are able to perform what's called IUI, but definitely make sure that they are equipped with the necessary tools to not only collect the sperm, wash the sperm, spin the sperm down, and then safely introduce it. It does require some additional training that some general gynecologists do have. Other things that can be done easily with your gynecologist is if the reason for your infertility is mainly an anovulatory state, so such as PCOS, you're just not releasing the egg as we expect you to. Most gynecologists can easily handle ovulation induction, monitoring of that ovulation, and then making sure that you have intercourse in the appropriate time. Again, have this discussion with your gynecologist, get an idea of how much your GYN can treat, and at which point you may need to start seeing a reproductive endocrinologist. If you're over the age of 35 and you've been trying for 6 months or more, that's really when you should start having that discussion and see if perhaps you've done everything you can before you can start getting that referral to REI. If you're under the age of 35, you typically want to try for about 12 months. And if you're still having some difficulty, it's also time to start having that discussion. I hope this was useful. Again, always make sure you have an open communication with your doctor, ask lots of questions, and if you have any for me, definitely put them in the comments and I will be happy to answer them.